she is a doctor. And she is the co-founder of Health 2.0, which I highly recommend you take a look at, and I'm sure you will when she's finished. It's a conference and media platform company that promotes, showcases, and catalyzes new technologies. Think about that, catalyzes new technologies. Indu was the entrepreneur in residence at Physic Ventures, Vice President of Healthcare and Biomedical Research at Gerson Lehrman Group, and Director of Outcomes Research at Quorum Consulting. You see, this is quite a career for a doc. An engaging interviewer and thought leader on health technology issues. She's interviewed many folks, including Jillian Michaels, Tim O'Reilly, and Anish Chopra. She's moderated panels and conferences around the world, including South by Southwest Interactive and the Clinton Health Matters Activation Summit. Join me in welcoming Indu Subaiya.
Thank you, Len, and it is such an honor to be here today. I hail from Los Angeles, California, so while we might not be the healthiest state in the country, I'm proud to be here and really enjoy the atmosphere already. I have to say, I got in late last night, and this is an example of why your state is so healthy. And the lovely lady at the front desk, I hadn't had dinner, my flight was delayed, and I was starving, and she said, well, I do have some cookies, but she was apologetic about it. And I thought, that tells me I'm in Colorado. I ate those cookies. But anyway, it's lovely to be here. And I'm going to share with you today a perspective from the health technology community. I think we're at a unique convergence of what I think is public policy, public awareness, and developments in technology. And I think with this convergence, we have a unique opportunity to come together as diverse communities to really make a difference. And I'm hoping today to share with you some examples of how we might do that. So let's start with, just jumped ahead a little bit excitingly. Okay, so Len asked us in this session to think about how we connect health systems to health outcomes. And I thought it would make sense to first go back and look a little bit more closely at the domains that have been responsible traditionally for health outcomes, perhaps through different lenses and methodologies. And that is the domain of public health and domain of clinical medicine. This is not news to any of us in the audience, but it was worth revisiting the definitions and the goals of these disciplines. So medicine is the science and practice of the diagnosis, treatment, and prevention of disease. And it calls on different terms today: biomedical research, genetics, diagnosis, et cetera. And it's primarily, though, a focus on the individual and his or her relationship with a care provider. That's sort of the beginning point of clinical medicine. It has to do with the examination of the physical person at its roots. Public health, on the other hand, is the science and art of preventing disease, prolonging life, promoting health through organized efforts, informed choices, society organizations. Words like interdisciplinary, health behaviors, multidisciplinary, and surveillance are words that we use in public health. And it's interesting to me today that these domains have traditionally been different and separate. And in some ways, in order to connect health systems to health outcomes, we now have to think about what these domains share as goals, but also as tools and methods to achieve their goals. And I believe that connective tissue is data and technology. So today, what we think of when we think of connecting health systems to health outcomes is in some ways this game of ping pong. We have a patient that sort of bounces in between different services and it's a referral-based system at best, and people fall through the cracks. We're often too late to get to the true cause of an outcome. No one is held accountable, and we know that. So enter the ACA, and here we're now in a world where providers have to be accountable for the outcomes of their patients, for population-level metrics. And yet, how do we actually get there? What are the things that are going to enable this transition? We know that we need, on the one hand, data. And data is something that's been talked about already this morning. It will be talked about a lot over the next few days. Data is a means toward transparency and accountability. It's going to show us what we're measuring and whether we're stacking up against what we're measuring. And we need integration. And for that, we need technology platforms that allow the flow of information so that we can have collaboration. So where does then the digital health community fit in? So we know we need all of those things. We know we need this integration. We know we need this accountability. We have data, we have technology, but how exactly do we connect the dots so that the public health domain, the clinical medicine domain come together to eventually serve the goals of the triple aim, as Len mentioned earlier. So for the past 8 years, the digital health technology community has been hard at work. This is a community that I'm going to tell you a little bit more about, but they've built thousands of solutions. And they did this in order to fill either a gap that was perceived, a gap in access, a gap in information, a gap in connecting to the provider system. And they build things like companies like you're seeing here today. I think it moved a little quickly, but this is just a snapshot of a database that we look at at Health 2.0 of companies building solutions. And you see here, if you search on population health, and if we search on remote monitoring, transparency, and more, you're seeing a whole ecosystem of companies that are attempting to address many of the issues that we need to solve today in the world of accountable care, but they weren't doing it for those reasons. They were plugging this gap, like I said, either because there was something that they weren't getting access to within the healthcare system, or they wanted to, in some ways, optimize their experience in the healthcare system. So that's where Health 2.0 fits in. And I'm going to tell you a little bit about the history of this movement and how maybe it has some of the tools that we can use to get where we need to get to. So before the ACA mandated it, and before the iPhone enabled it, this was in 2006, Health 2.0 began as a movement with the person outside the healthcare system trying in some way, shape, or form to be healthier and to connect with the healthcare system. It came on the heels of a movement called Web 2.0 in 2003 that was built on the principles of lightweight technology platforms and connectivity between individuals where people could connect and share experiences and self-publish. These were the early days of blogs and wikis, if you remember. And many of us were asking, what would it mean if these lightweight technology frameworks and means of connecting people could be applied in health and healthcare? And that's where the term Health 2.0 came in. So Health 2.0 was literally us borrowing the term Web 2.0 and applying it in health and healthcare. And as we evolved, we kind of came up with a 3-part definition. These are, because how is it different than, say, traditional health IT or e-health, terms that had existed before then? So first, these are tools and technologies that are inherently adaptable. They are not standalone. They play well with others. And as we can imagine today, that's increasingly important as we think about integration and connectivity between these systems and these shared goals that we have. Second, they focus very, very strongly on the user experience. And something isn't, to Len's point about motivation, we're not going to get something to be used. No one's going to engage with the technology if it isn't actually satisfying their experience, making their experience better, being centered around them. And third, this is so critical, these technologies all use data in some way to drive a better decision, whether that's a decision by a patient or a decision by a provider or an administrator in the healthcare system, regardless of stakeholder. And this is just a snapshot of the companies out there today. These are over 3,000 companies categorized into 19 segments. I'll let you take a look down the aisle here. The largest category are these self-management tools and trackers. And I thought this was important to point out because when we think about outcomes and what's going on in the lives of patients or consumers or clients, whatever we want to call it, these are folks actually managing and tracking their own health. And people will say, well, that's really, no one really does that. It's a tiny proportion of the population, right? It's actually 7 out of 10 people tracking their health according to the Pew Internet study, not all using the iPhone, perhaps, or a smartphone, but they're tracking their health in some way, shape, or form. Where the gaps are is that the information, the data that they're collecting and keeping track of might not be making its way into the clinical environment, into the care delivery environment, but it's happening. It's the largest segment we track. We also have a number of professional-facing tools in the ecosystem as professional knowledge exchanges become more important, clinician workforce tools, administrative tools, looking at revenue management cycles and others. So this is a whole spectrum of technology that share those three criteria I mentioned earlier, being adaptable, user-focused, and data-driven, to distinguish them from possibly previous generations of technologies that went on before. And it's fascinating to think that when we started as a community in this space in 2007, we were looking at maybe 30 companies, and there came the App Store in 2008 and the Affordable Care Act in 2010, but now we're looking at 3,000 plus companies. But what's important about this graphic, and I show it, is that these weren't solutions necessarily that came about because policy mandated, and they didn't come about necessarily because it was going to be on a smartphone. They started before. They started from the point of view of what do we as consumers and patients need to be healthier, and that's an important distinction, and we'll see sort of how that plays in. So if you look broadly at the functions of Health 2.0 technologies, they fall into 4 buckets. They're either focused on content, providing information and education, and that could be something like scanning the barcode on a cereal box that you had this morning on MyFitnessPal and having it tell you exactly what the components of the calories are. It could be around connection. We're going to look at an example of Doctor on Demand, a lightweight telemedicine platform. It could be diagnosis. We're seeing a whole generation now of lightweight tools that are enabling remote diagnosis in the hands of patients, whether that's looking at your skin through a little $99 device that's going to be available from iDoc24 to the Theranos of the world, enabling us to take drops of blood and have the value and the results that might have come previously from a lot more cumbersome process. And all the way to treatment. There are now technologies that are providing virtual reality goggles for patients with PTSD, building 3D casts in 1 minute from 3D printers. So they're spanning the spectrum of the care delivery process. And another way of thinking about this is, so those are the functional areas of Health 2.0 technologies. They also represent a progression. And this is really important in terms of where we are today, talking about connecting health systems to health outcomes. When I say we started from the outside in, when we started with the patient, these were folks building solutions because their voices weren't being heard by traditional stakeholders in health. We call this user-generated healthcare. And it came about because in the early days, and I'll give you an example, people were not satisfied with the types of data that were being collected traditionally and wanted to do it on their own. The next step was, well, once we do that, we do ultimately need to connect to providers. So what are the means and ways we can do that using data and technology? Third, hopefully this would lead to some type of partnership to reform how care is delivered. And ultimately, once we're able to connect all of the parts of this ecosystem, data would hopefully drive decisions and discovery across the continuum and spectrum. So let's take a look. So this is, in 2007, a company called Patients Like Me debuted, a group organized by patients to track aspects of their health, many with life-threatening neurological conditions, but the community has grown now to tens of thousands. And people looked at them like a sort of anomaly. Well, that's interesting. That might or might not be relevant, and maybe it's going to help people feel supported by each other and good for patients. Fast forward, 8 years, and Patients Like Me is now part of Walgreens. And they have included Patients Like Me as a part of their dashboard in looking at the side effect of medications. What was happening was these patient-recorded data streams were becoming almost like real-life clinical trials, and we were gathering data that almost could rival what the FDA might do in one of its clinical trials. And that, to me, is unheard of. Those of us looking at Patients Like Me 8 years ago thinking now it's part of Walgreens, that's one of those integration points that's wonderful to see happen. Let's look at Amy Tenderich. This is an individual patient. Many of you might know her, an advocate and a wonderful journalist. Amy has type 1 diabetes and started out as one person with a blog. But she was so articulate and so able to mobilize both the technology community and the industry around diabetes care that her platform is now one of the most important ones looked at by industry when developing new tools for diabetics. And she and her community are co-developers, if you will, in this process of innovation in diabetes care. And Diabetes Mind is now part of a larger platform and has gone on to become more than just a blog. But that began with one person with diabetes who was dissatisfied with what was out there. MedHelp began as a simple Q&A forum. You know, we all know those forums. Even the best of us still go online and put in our symptoms, even if we're doctors or have, and you know, you will land on one of these forums, right? You know, why is my knee, you know, bloody and hurts in a certain way? And MedHelp started as that Q&A forum. It now is in a partnership with GE and Physicians Interactive to build a whole new set of applications, not just for patients, but that might connect providers and consumers around these issues of health and tracking. So again, this was movement from outside in, from organic activity among and by patients and entrepreneurs to create a better way, and that has now found its way into integration. So the second stage of Health 2.0 is where consumers connect to providers. So I remember in the early days, we were thrilled that Kaiser, systems like Kaiser would allow you to email your doctor. That was progress, and that was a means of connecting patients and providers through technology. But now it's exciting to see how partnerships like this, where Kaiser might partner with a Target who itself is rolling out applications for patients to manage their health and access Target in a new way. What would that mean if now that was an integrated environment with a Kaiser clinic offsite? With Kaiser's whole slew of data and technology offerings. So I think it's fascinating to think about these partnerships around connecting patients and providers. Doctor on Demand, I mentioned them earlier, just one of what we're calling the Uber of healthcare. There's like 12 of these companies just in the last 6 months that have come onto our radar, making access to a physician easy, fast, almost immediate. So not the telemedicine of 15 years ago, but really phone-based. Doctor on Demand tells us that they can address 19 of the most common reasons people go to an emergency room and close that loop without a referral to an inpatient setting just through this virtual platform. And they're just one of many, so I don't mean to just focus on them. So this is another example of connecting consumers to providers. This was an interesting company, Vitality. They create a whole number of sensors from looking at being able to look in your ear and take a photo. That's that green gadget on the left. It can actually help you diagnose an ear infection, frankly, without the presence of a physician, but they're part of the FDA review process, so ultimately a physician does have to make that call, but only because we're sort of in the early part of, I think, of a regulatory spectrum. I think down the road, these are going to be in the hands fully of patients and consumers. A whole bunch of tests of blood, urine, and others that you can do literally on the spot and at home. Sensors for EKG, lightweight. This is part of the X Prize Tri-Quarter Challenge, and a picture of things to come. In that little area, you kind of have almost everything that you might have in a doctor's office in a much more heavy-duty, intensive way. But this is now distributed, lightweight, affordable in the hands of patients. So the third stage of Health 2.0 is, and it's something that we're thinking a lot about today, is so if we have this technology, if we have this consumer engagement, ultimately we need partnerships to reform delivery. And what is that going to take? So many of you might have heard about Propeller Health. They used to be called Asmopolis. It's the GPS-based asthma inhaler. And this is an example of, the types of partnerships that can reform how care is delivered. If you can actually track your asthma and someone can know what community you live in, what the air quality was doing that day, they might be able to make a more informed decision when they treat you. This is Withings. Asmopolis and Propeller Health, they still call them by their own name, has been around for a few years, but this is brand new. Withings is part of this new movement toward the home, to monitoring the home like a thermostat, but this time for health drivers. Withings will not only do facial recognition in the home and other types of scanning, but it will measure the component in your air of volatile compounds that are harmful. So it's an air quality monitor as well for your health, making the home another environment that's equally important to drive health outcomes. This is producing data that can be integrated into the clinical record. That's the beauty of digital technology. This can be integrated and captured. When we think of partnerships to reform delivery, UCSF looked at a place that there was inequity in the lesbian, gay, and bisexual community. There were problems with issues of equity and not enough data. So there's a study now called the PRIDE study that's going to look at longitudinal health using technology to better address and serve this community in terms of population health. These are the types of partnerships. New York State has an innovation challenge around its data. The Department of Health in New York State wants to make data available to entrepreneurs to build solutions that will help people choose health systems based on their performance and their outcomes. This is something that is part of the open data movement that was championed by HHS a few years ago and has real implications for what can be built now that data is being made available. So the challenge here is, can we look at the cost, quality, and efficiency of services in New York State inpatient facilities, but allow entrepreneurs to build the tools to navigate this? The ONC has a current challenge out right now that connects technology companies with leading care delivery organizations. And here, again, it's around what problems we're trying to solve and what are the partnerships that we can forge in self-selecting ways to address them and to make some meaningful bridges between these communities. So finally, the Holy Grail, and we think of this really as the Holy Grail. Ultimately, we want to be making better decisions, whether we're administrators, whether we're patients, whether we're doctors. Any stakeholder in the system ultimately needs more information to make better decisions. That ultimately is going to get us to that system-level improvement we so need. So what are some of the companies really working at the intersection here and some of the ways and examples? So I talked earlier about this huge ecosystem of devices and sensors and people tracking their own data. Well, gosh, that's got to be overwhelming. How do we make sense of that? Well, there are companies now that are providing that integrated interface to the clinical setting. So they're going to say, don't worry about making separate integrations with the Fitbits of the world and the Propeller Healths of the world and all of the different devices. It's too much. Let's have integrations in a single point. And there are companies like Validic and others who will do that and work to bring it all together in one place so that patient-generated data can be more organized and more easily integrated with the EMR, the clinical record. Groups like IBM's Watson is now analyzing data from HealthKit on the iOS platform. And to me, that's incredible to have artificial intelligence drawing conclusions from all of this data that we're tracking about our health. Because again, it's just noise until it's actionable, until it's integratable, et cetera, as well as working with these device manufacturers like Medtronic and others. So that there's help. Help is on the way in terms of making sense of this wonderful set of data streams. This is a company called Centrion that's taking what they call remote patient monitoring to the next level. And they want to bring algorithms that will identify early signs of deterioration well before they would normally hit our radar as case managers or as providers. And they're doing it through artificial intelligence and looking at these data streams of the various devices and the technologies that patients have access to in their home. And a number of institutions coming together to really catalyze and encourage this cross-pollination. So the Aetna Foundation and HHS and NHIT saying we need solutions that are going to address inequity. We want solutions that enable better access to information, to services that address language barriers, using technology so that communities that have been underserved can be part of the progress we all hope to make. The California Healthcare Foundation, I thought, had an interesting challenge where they challenged the tech community to crowdsource ways that we could bring the social determinants of health to our providers. How can a patient actually communicate that in an organized and efficient way? We need solutions that don't exist today. And some of these mechanisms of partnering can create that, can tell this wonderfully enthusiastic and talented technology community what to build, what do they need to do. So those are the sort of 4 stages of Health 2.0, and in some ways, I think are a roadmap for how we might work together to really leverage data and technology and this digital health ecosystem in the goals that we have, in the shared goals that we have. And as I was thinking about, the healthcare industry, I was struck. My husband's in the music industry, and we talk all the time about the disruptive forces that are going on in many, many parallel industries today. And I think healthcare is no different. So, you think about traditional publishing versus Twitter. Do you read the New York Times or do you read Twitter? Well, both, right, is the answer. Blockbuster to streaming services like Amazon and Netflix, Capitol Records, my husband's sort of world with the music industry being very centralized, and now iTunes, and now people kind of, going off of iTunes, from yellow cabs to Uber. What we're seeing is a similar pattern. And what isn't on here, and one that I find fascinating, is manufacturing, moving to 3D printing, something I can have in my own home, instead of something coming from China or wherever it is. That's radical. And what it is saying is that there's distribution. Things are going to get locally distributed. They're going to be democratized. These are user-driven models. And I think as traditional stakeholders, we have some choices. What role do we play? Do we compete? Do we try to reinvent? Do we participate? I mean, the answer is I think we participate. But that's where we are in healthcare today. And in my opinion, I think the most successful organizations through a cycle of disruption are ones that take advantage of organic activity that's already happening. And that is so critical in health today. The thousands of companies I told you that are building solutions are doing it anyway. And there are many, many ways in which we can leverage that and work together. And ultimately, if we think about where we want to get to, I would say 3 things. One is patients are documenting outcomes. They're doing it on their iPhone. They're not thinking that that's what they're doing, but they're telling us about their lives and what actually happens to them on a daily basis. They are keeping track of that data stream for you. So how do we find structured ways to listen and respond as health systems? We're going to hear the word partnership a lot. But there are actually easy ways to say, I have a need, there might be a solution, I don't have to reinvent the wheel, how can I partner? And many, many, many organizations, many opportunities today to connect, to share, to learn. We see constantly a lot of wheel reinvention, and it's very frustrating because it's like, you needn't have spent those thousands of dollars. There was a young team that would have done that for you for the cost of bagels. So we really encourage you to think about partnering with an existing solution. And finally, we're going to think about, there's so much consolidation going on right now in the industry, from health plans to hospitals, we know that. And while it's under this idea of, well, we want to be more accountable for care, we want to do the right thing, it's also, in some ways, an element of also trying to resurrect boundaries of ownership. And I think it's important to say, while we think about how we're redrawing the map, redistricting in a way, how can we focus less on ownership and more on participation? No one institution or system is going to be entirely responsible for a complex pathway that leads to a health outcome. We know that. That's what we're all talking about here. So how do we participate instead of trying to do those other things? And so I leave you with that hopefully we go from this sort of ping pong of a referral system we have today to one in which we really are more connected through data and technology. Thank you very much.